So good morning, Nicky. Today we have Nicky Mcleod from New Zealand, who healed herself from epilepsy of 13 years of grand mal epilepsy. And within something like a month, with the method that she used, she was off the drugs, off the medications. So thank you for coming, Nicky. And can you share with us how everything has started? How did the malady started?
The seizures?
Yeah, the seizures.
So I had two types of seizures, grand mal seizures and partial complex seizures. And the partial complex seizures, I think, had gone back to a young age. It was like deja vu, but so powerful. It's like being haunted, but I didn't realize. I'd always had them, I think, so I didn't realize that it wasn't normal. And the grand mal seizures started after my first pregnancy. And then in my second pregnancy, I woke up one night in hospital and I was 3 months pregnant and I had 3 seizures in a row. So I was at risk of status. I wasn't having, the seizures weren't even monthly, they were only a few a year, the grand mal seizures, but the neurologist told me that they were, a risk of dying, low but severe. And so I was put on medication 3 months pregnant and was on that for the next 13 years until I did a Buteyko course.
Oh.
And I just accepted it. It's epilepsy, you don't question epilepsy. I had yet to start my holistic health journey, and where I started to question everything and always be looking for a root cause. That was to come later. I just, just accepted. They said, you have epilepsy, you need drugs. And I went, okay.
Wow. So you had 2 children.
Yes.
To raise with this issue, and
yes, and that wasn't easy because those drugs, they flatline you.
yeah.
So I was pretty much a zombie for a lot of those years.
Sure.
No highs or lows, just going through the motions of life, really.
So how did you, although you were flat because of the drugs, what was the emotional baggage that was on top of the malady? What were your thoughts and feelings? How did you grasp yourself? What was your inner self-talk back then in relationship? Your inner self-talk in relationship to the issue that you are.
I was pretty unhappy. I got postnatal depression very badly after each of my children. Life was just hard work. I was, and after a while, I tried 3 different drugs over those years. And actually the third one became, finally I had no side effects on that third one. And then I just accepted. It just wasn't a big deal in my life. I wasn't having seizures. I wasn't having side effects. The drugs were controlling it. But for, I don't know how many years it was until I got on that drug, maybe 8. It wasn't good. I knew that I wasn't in a good way. I was pretty unhappy. And
yeah. Do you remember a time or an event that you felt really, really down?
Well, after each of my children, I had very, very bad postnatal depression.
Yeah.
And I didn't realize the whole link. It was all linked to breathing.
Yeah, so except for medications, did you try other modalities like acupuncture?
No. Mm-hmm. No, I wasn't very awake then. in terms of health. I wasn't questioning and looking for root causes, and I was just pretty accepting.
And what was the turning point in the plot?
Well, it was only by chance. It was the reason I found Buteyko and did it was because of my husband's snoring, and I knew that snoring wasn't healthy, and that it wasn't, it was having a really bad effect on me because I couldn't sleep well beside a snorer, but I knew it wasn't good for him. And every time I Googled snoring, it took me to the Buteyko Breathing Clinic website. And it was a couple of years of looking into it before I started to read everything I could about Buteyko, and I thought, but I wasn't interested in it for me. I had no idea that I had such dysfunctional breathing. I would have told you that I had great breathing. In fact, I tried, when I signed up to do the training, you had to do the course as a client in order to become a practitioner. And I tried to convince my teacher that I didn't need to do the course as a client because I had such great breathing. I went to yoga, and actually it's in yoga that I did a lot of damage to my breathing. In yoga, I got the idea that you should always breathe deep and full. And I'd learned in yoga, I was already a chronic overbreather. And what I learned in yoga had me doing that even more. If I couldn't get to sleep at night, I would empty and fill my lungs, major over breathing to set me up for a seizure in the night, because my seizures were only ever in the early hours of the morning. And that's when we hyperventilate. So that was an interesting link that was missed by the neurologist, the fact that I only had nocturnal seizures.
So after the Buteyko training, or as a client, when you just practiced the Buteyko, how soon did you notice a shift in the symptoms?
So there was a big change in my sleep quality within the week. It's quite common with my clients now for them to get a 50% reduction in breathing related symptoms within a week. The changes can be quite fast. And after a month, I decided to start dropping my medication and see what happened. And nothing happened, so I kept dropping it. So over 6 months, I came off the medication.
Nice.
But it was a big shock to me to find that I needed this course. I actually, had extremely dysfunctional breathing and no idea, way worse than my husband's ever had. It was very, very surprising. And it was the beginning of a long journey, and I'm still on it 6 years later. Because my control pause, which is a measure of your breathing health, which should be 40 to 60, mine was 8 when I started with my seizures. So I was in the severe zone of dysfunctional breathing. And within that, with that first training course, I got up to the 20s. And I've been doing more advanced training this year, and I've got up to the 40s. And every 5-second increase in the control pause can lead to a noticeable reduction in symptoms. So yeah, it's been, I haven't stopped training and learning since that first course, always seeking out new teachers and reading books and learning everything I can. Breathing's a very big subject.
Why is it so difficult to change our breathing pattern? Like a movement pattern is easier to change. Why breathing pattern is so hard to change, let alone recognize it? But even if you recognize it, why do you think it's...
So we have the respiratory center, the medulla oblongata in the brainstem, and your tolerance to carbon dioxide and your drive to breathe is set there. And you only have to overbreathe for a short period of time, like for, say, through the flu, just for a few weeks, for your tolerance to carbon dioxide to come down. We're very sensitive to carbon dioxide, or through a very stressful time like a divorce or something like that, or grief, or and we any kind of stress on the body really, and we overbreathe for a short period, but then we get used to an abnormally low level of carbon dioxide, and we breathe in a way that maintains that.
So actually the Buteyko method, can we say it is training the stem cell to tolerate more CO2?
Training the respiratory center to accept more carbon dioxide. And it's a little bit of a complex thing to explain, but carbon dioxide, it's carbon dioxide that enables us to access the oxygen that's in our blood. The more you breathe and the lower your carbon dioxide, the less oxygen you get at a cellular level. So this Buteyko knowledge turned everything, it was very surprising. Very
and why is that? Is it because of the vasodilation of the blood vessels that
you've got carbon dioxide affects smooth muscle, and you've got smooth muscle around all of the tubes in the body, and you've got about 100,000 kilometers of tubes in the body. And when carbon dioxide is abnormally low, smooth muscle tends to spasm. And how that affects you will depend on your genetics. But for me, it was to do with, blood flow to my brain. For someone who has asthma, it's smooth muscle spasm around the bronchi, that's bronchoconstriction.
So can you say more about the brain? Because the Buteyko method is very much correlated to respiratory issues like asthma, like COPD, like snoring or sleep apnea, but how is it related to epilepsy? How do you explain the mechanism that it resolved the seizures?
Well, the brain is the biggest user of oxygen in the body, and it's affected, quite significantly by breathing. And you've got smooth muscle around arteries and blood vessels. And so over-breathing, you only need to over-breathe for 1 minute to drop the oxygen to the brain by about 40%. And I over-breathed all night long, mouth breathing and lying on my back. I would have said I didn't mouth breathe much at all, but in the day, because whenever you mouth breathe, you're over-breathing. Straight away, you're breathing in at least double the amount of air that's normal.
Right.
So in the day, there's all these leaks, like when I backed the car and when I was concentrating, when I exercised, and this all added up. So a reduction in oxygen supply to the brain.
Yeah, it creates seizures like.
And there's another aspect to it as well. There's that smooth muscle spasm around blood vessels and arteries and around tubes in the body. So that can mean that you've got less less blood getting through, and less oxygen. But then there's also the Bohr effect. Low carbon dioxide changes the bond between your blood and oxygen. When your oxygenated blood gets to your cells and your muscles, it needs to release the bond with oxygen so that it can move into your cells. And it's carbon dioxide that's like the key that enables the oxygen to release from the blood and move into the cells. And when you're over-breathe and carbon dioxide levels are abnormally low, oxygen doesn't, it's not all at a cellular level, you get less oxygen released and it's released more slowly.
So do you believe that the Buteyko method, because you mentioned in a previous talk, you told me that any chronic condition is deriving of deprivation of oxygen in the cellular level.
Yeah, I think it was Dr. Guyton who said that.
Who said that?
I think it was Arthur Guyton, who wrote the world's highest selling medical physiology textbook. All disease begins with a lack of oxygen at a cellular level. Anyone who
So,
wants to understand that physiology would do well to look up the Bohr effect, B-O-H-R.
yeah. It's something that Dr. Buteyko mentioned as a rationale to his insight.
And basically the effect, of it can be summed up as the more you breathe, the less oxygen you get due to the Bohr effect.
I mean, it makes sense because sometimes when we prescribe the symptoms, we solve the problem. So if you have a shortage of breath and you hold your breath and you are correcting, something is happening. Maybe mysterious, maybe physical or physiological, but can I ask you, Nicky, I wonder if the cellular, if the oxygen deprivation in the cellular level is what causing inflammation and chronic conditions. Can, in your opinion, can this method cure so-called unrelated issues like arthritis or autoimmune diseases or fascia issues? I am talking about the connective tissue because these tissues are, by default, they don't get enough blood circulation. Do you think that this method can help even maybe cancer patients, because cancer cells thrive on an oxygen deprived environment? So do you think that this method can heal almost any condition?
There are examples, people all around the world who would say yes to that, because they've done it. Yeah. I would add, it's not an easy, quick fix. It's a long, slow process. And the biggest challenge people have with it is sticking with it.
Yeah, exactly.
But if people are able to do it, what I'm seeing more and more as I teach people is that if people do this properly, it works. And the biggest challenge is getting people to do it. So the more well-known conditions that it makes an incredible difference to and may even reverse would be asthma and hay fever, snoring and sleep apnea, panic attacks and anxiety, insomnia, chronic cough.
Right.
But the chronic fatigue, good results with that as well.
How about fibromyalgia?
Yes, there are lots of cases of it helping significantly with that. And even with cancer, we have practitioners like Misha Shakarov working with Buteyko and reversing glioblastoma, which is unsurvivable brain cancer, reversing stage 4 cancer, autoimmune diseases. I know the doctors in Russia and Dr. Buteyko were reversing autoimmune disease and cancer. Yes. You would need a very experienced and competent practitioner, a high-level practitioner for that kind of work. Yeah.
But it depends on the client, on the patient, and
always, yes.
And I do want to ask you now, as a trainer, as a Buteyko practitioner, what is blocking the people that come and with good intention to heal with this method? What if you observe the people who succeed and people, what is blocking people actually? What is hindering people to be disciplined? Because you mentioned that you need discipline. It's like a gym, that you have to do it not once but to keep repeating it. And I think Misha Shacharov I saw one of his videos today, and he's talking about the Kaizen method, the Japanese method of small incremental improvements, and not, not using the willpower, but doing it in baby steps. So
you have to be willing to look at life. And a Buteyko course involves not just the breathing exercises. That's probably a third of the method. And another third is being prepared to address habit factors and lifestyle factors that are negatively influencing the breathing. And these are things that are not easy to address, like stress and eating and movement and, our habits. And then another third is physical exercise. And again, that's not an easy thing. Once your control pause gets to about 20, a major driver for ongoing improvement is movement, physical exercise. The biggest factor in whether people apply this and how well they do often is whether they get it, whether they get the link between their breathing and their health condition, and also their pain point. How bad is the health condition for them? Because the people that come and see me and they just want a health hack, they're actually really healthy and they just want more health. They want to be in the best health they can be, and they want to know everything there is about health. They sort of peter out after a little while because they weren't really suffering and they don't see, major changes. So there's not that motivation to keep doing this long term. But people who are very unwell and really searching for something, and who have a lot to gain, they tend to do well. They get quite noticeable improvements quite quickly, and that motivates them to keep doing the work. And then they might lose motivation and stop for a little while, but then things get worse again, and that just proves to them that this is the right thing to be doing, and it gets them back on track.
So it's the consistency. And how often do you advise people with pain or with inflammation or with any other chronic condition? How often should they practice this conscious breathing? Because we breathe all the time, of course.
Yeah, so there's very specific breathing exercises that we teach people, and it takes 20 minutes to half an hour maybe to do a set of breathing exercises, and the minimum is that they do that 3 times a day. But it's not just that. It's no good if they do the breathing exercises but then they stand up and they start mouth breathing. There's a whole lot of awareness that has to be applied in between as well, to nasal breathe and not to sigh all day long, and to take relaxation into the day. So the relaxation that they're learning in the breathing exercises, it's really vital to learn to take that into the day as well. If you get off your chair, you've finished your breathing exercise, and straight away you're all tense again,
yes,
you won't get very far.
But can I ask you that the practice itself can be very stressful, because you feel...
No. If it's stressful, you're not doing it right. Yeah. So you can reduce, because basically when you're doing the breathing exercises, you're breathing less than you normally would. If you try to do that through control, it can be very stressful. And if you have panic and anxiety, it can trigger you and make you worse.
Right.
The key is in learning to breathe less for the short period of time through relaxation. And the relaxation is the key. And it's the biggest challenge for modern humans to learn, is to learn to relax. Our lifestyle is not geared to promote and facilitate relaxation. So I explain to my clients, it can take weeks and even months to learn to relax.
Yeah, and it's like a cycle, because if you do the Buteyko breathing, then eventually you will be more relaxed, more.
Exactly. If you over breathe and you've got low carbon dioxide levels, that causes tension in your muscles and tension in the diaphragm. which of course contributes to over breathing. There's a lot of vicious cycles with breathing.
Nicky, can you let's dive a little bit to the details. So people take a breath, a very slow and shallow breath like oxygen, and then they take it out, and then they stop the breathing, and they measure the control pause, how much seconds they can stay without inhaling again. Is it like
Yeah,
that? So to which degree, it's very difficult to discern when it is the natural time to take another inhale, and when you are striving and pushing the holding the breath too much. Can you say something about it? Where goes the fine line between challenging yourself and striving too much?
I think you're talking about a really big difference there between control and relaxation. If you're doing it through relaxation, none of those things you've just mentioned are of concern. If you shouldn't be trying to slow down the breathing or breathe to a rhythm or suppress the breathing or control it in any way. If you are, you're not doing it correctly, and it may backfire. The focus is just on relaxation of the muscles. And I take people through a progressive active relaxation that starts with their facial muscles, and the facial muscles are connected to the vagus nerve. And you can relax engage the parasympathetic nervous system with this. And so it's anytime you find yourself trying to control the breathing in any way, you shouldn't be trying to, resist the next inhale or force a pause at the end of the exhale. None of those things. Those things all come in time as you get used to a high level of carbon dioxide. The breathing naturally slows down, a pause starts to develop at the end of the exhale. If you're in the training trying to force those things, you're doing it through control rather than relaxation. It's a crucial difference. And I know it well because for the first 4 years, I tried to breathe less through control. And it's only through working with Misha that I've learned to do it through relaxation, and I started to really get some progress.
Yeah, thank you for emphasizing this, because I think this makes the break, because you can do buteyko and excite the sympathetic nervous system if you do it with willpower, with
yes, I think I said to you in our previous conversation, it's a really big deal to interfere with your breathing, to work with someone's breathing, your most foundational pattern.
So how quickly does the brainstem learns to adapt to
Well, it can be quite fast. Like I said, we can see quite significant changes, quite significant improvements within the first week. But having said that, you want to go very gently with this process. You don't want to. Carbon dioxide is calming and relaxing, but you don't want to increase it too fast, because that can backfire and lead to panic and anxiety. It can make things worse. It's really crucial, if you want to do buteyko, to engage a coach, a practitioner, a good one. And there's so many kind of subtleties to it. There's a little detail that's really important that if you get wrong, can mean that you're just wasting your time, or even worse, that you make things worse. Yeah, it's like, I would explain it, if you wanted to learn karate or yoga, you'd be pretty unlikely to get very far just with a book, trying to do it yourself. You need to engage, you need a master, you need a teacher, you need someone to take you through.
Yeah, otherwise you can create havoc on your system if you do it just
yes. if you get the impression, if you do Buteyko and you learn control, yeah, it's potentially just going to make you very uncomfortable with your breathing for the rest of your life, and that would be awful. That's not what it's about. Yeah, I've heard stories of people say that they tried it, but it made them very anxious and uncomfortable with their breathing, and something's wrong there. It shouldn't be like that.
Nicky, can you say something about because you mentioned before the parasympathetic branch of the nervous system as a vehicle to healing. And we know now, that the safety sensation, releasing oxytocin, is the ground on which the healing process is happening. Can you say what is your take on how to cultivate a sense of safety in people with that usually they had traumas from life, from early childhood, or life itself is a big trauma, but how did you do it? Because you mentioned that now you look very poised and very relaxed and very collected and very calm. Good for you. How did you teach yourself from a place of worries and feeling unsafe with the epilepsy? And anyone who has a chronic condition is terrified of his...
Breathing is the key. Breathing, if you think of breathing as information to the body, you can breathe in a way that is giving your body the message that you're in danger. And it's a vicious cycle. So if you breathe from your mouth, straight away you will engage your secondary respiratory muscles in your neck and your upper chest. And when you breathe from those muscles, you engage your sympathetic nervous system, the stress part of the nervous system. And it's game on, and you're stuck there. So you can change the way that you breathe and change the message that your body's getting. And I wasn't always like this. If you talked to me 6 years ago before the Buteyko journey, you'd probably not want to talk to me for too long. You'd feel agitated talking to me. You'd pick up my own, the sympathetic dominant state that I was in. I had, when you overbreathe and you've got low carbon dioxide and low, body oxygenation, there's a hyperexcitation of the nervous system that goes along with low carbon dioxide, and I very much had that. It was very much linked to the seizures, and a major effect on behavior. So people who overbreathe with a low CP can be anxious, depressed, fearful, volatile, irrational, hostile. I was all of those things for years, and I just thought it was my personality. And it's been amazing through this process to see those things fall away. And I would say that those things are not the natural state of any human. Our natural state is one of love.
Wow.
It's been fascinating.
So this brings me to my next question. Which layer is the ground? Is it the emotions and the thinking, or the breathing? I know they are intertwined. Of course, they are intertwined, but in the world of chronic pain and chronic condition, many people are advised to do some mind-body work, to work on their emotions, to accept their emotions, to not to resist what is, but to acknowledge, accept, and then it will discharge of its own. It will lose its power. Like the Japanese say, let the flower bloom and it will wilt by itself. But if you suppress it, if you suppress the seed, then it will always it will always bug you. It will always want. So my question to you is, in your opinion, as you see it, is the breathing the basic to that emotions are on it, or is it the other way? Is there a deeper level beneath the breathing, like our emotions?
Yeah, it works both ways. Our breathing has a profound effect on our emotions, but also our emotions have a profound effect on our breathing. And if there's underlying trauma and unaddressed issues, then it can be quite tricky to rehabilitate the breathing. It may be that we have to stop and go, it's time here to go and get some help on a psychological level, and look at trauma and address trauma. Because, yeah, as we know, the body keeps the score, and the mind-body connection is huge. So you might be able to get improvement to a degree with the breathing, but then it may be that the trauma, we're coming up against the trauma, unresolved trauma, and you won't be able to get any further until you go and have a look at that and deal with that. And then also on a breathing journey, people can use their breathing to suppress trauma, to suppress emotions, to dissociate from painful memories. And if you start to work with them with their breathing, and they start to breathe in a more healthy way, the trauma can rise up. And yeah, and it can be, in that case, you know, that's beyond my skills or most Buteyko practitioners' skills to deal with that. They would then need help from someone, an expert in that field, with psychology to deal with that.
But actually, it's good that it is rising up.
Well,
in a way, it is.
Well, yeah, because if it leads to addressing it,
Yeah.
and healing it and moving through, then yes.
So during the 13 years of the grand mal seizures, did you believe that you will one day will be healed?
No, I didn't. I wasn't on my natural health journey then. It's epilepsy, you know. Epilepsy is so medical. It seems so medical. It's so scary. Now, with any condition, I would always be going, what's the cause? What's the underlying cause? Peel the onion. There's got to be a cause. And I would never stop looking until I found it. But back then I didn't think like that. I was just like, epilepsy, doctor, you know, do whatever. I didn't question. I didn't go searching. It didn't occur to me there could be an underlying cause. I didn't have a clue. I just did what I was told. And it was only in looking for something for my husband's snoring that's why I trained in this, to help my husband. I thought, I had no idea that I had so much, that my breathing was so dysfunctional. I was trying to fix my husband, which he didn't appreciate. And
so actually, what would be your advice to people who hear you and now they are in despair because of their chronic condition?
I would say never give up hope and never stop looking. Never accept a diagnosis and try and avoid diagnoses. They can be very self-perpetuating, you know, to get stuck with the label, especially to be told something like there's no hope. There's always hope. Someone somewhere out there is probably reversed most conditions, and it's a matter of seeking and, you know, keeping looking and having hope until you find something. And it might not be just one thing. It might be a little bit here and a little bit there.
That's right.
Not to have hope, that's a terrible place to go.
And if the situation is deteriorating, and you know that if it is a chronic condition which is in a plateau, this is something. But if someone sees his condition deteriorating and deteriorating from as times goes by, and he has this immediate fears and terror inside that he's not going to heal, what would you tell him? I mean, when he faces the decline in his health from day to day, and you know, immediately the self-talk goes to the worst case scenarios, and I am doomed, you know, broke on a wheelchair. The imagination goes south.
I don't know. I haven't been in that position. That's a really tricky one, because as well as not giving up hope, that also sometimes we need acceptance as well. And it's a fine line, isn't it? To know, because you know, if there's an inevitable decline going on, you know, because say someone's been injured by something, you know, by a chemical or something in the workplace, and they've actually damaged their lungs, for example, and it's irreversible, that kind of thing. There's a degree of acceptance required too, isn't there? If to get some peace around it. I don't know. I haven't experienced that, and
yeah. Thank you. This is humility. Now you demonstrate humility. Thank you for that. Can I ask you if there is a book that you recommend to people with a chronic condition, a book that affected you, that helped you transform?
Yeah, for me, it was the books by Tess Graham. She's a Buteyko breathing educator in Australia, and she's a physiotherapist and also a Buteyko practitioner, and she's got, you know, 20 years plus experience. I went to Australia for further training with Tess, so she's retired now, but she's written 2 books, Relief from Anxiety and Panic, and Relief from Snoring and Sleep Apnea. I'll just show you them. You know, yeah, and my journey of Buteyko and understanding it, and
what's her name? What's the name of the writer?
Tess Graham. So these books were very crucial for me on my breathing journey.
Relief.
And then, and just for people who are wondering about breathing and how relevant it is to them, there's another book that's just come out called Breath. Well, it came out.
James Nestor. Yes.
Yeah.
Yes.
So that's a fascinating read, and it will leave people no doubt as to the relevance of breathing health to everybody. And since this book came out, it's probably, you know, advanced the cause of breathing in Buteyko maybe 10 or 20 years. I've had dentists and doctors and specialists from the hospital even book in to see me after reading that book. It's been extraordinary. It's really put breathing.
But this book is not, is it aligned with the Buteyko method, or is just talking generally about?
No, there's all sorts of breathing methods out there, and he's talking about all of them, not specifically Buteyko. In fact, I'm not even sure if he mentions the word Buteyko, but it's interesting. He spent a lot of time with one of my colleagues, Anders Olsen, and a lot of the language that James uses, I recognize as Buteyko language, even though he hasn't really acknowledged it. But yeah, that brings me to, there is so much, yeah, with the breathing, there's a lot out there in the breathing world. You asked me about Wim Hof. Did you ask me about that?
Yeah, because everyone interprets breath work to his method. It's the pranayama, which is deep and deep breath, or Wim Hof with which is almost like hyperventilating, at least the first phase.
Yes, so people get pretty confused, and sometimes my clients, they've been reading all sorts of information about breathing and interfering with their breathing, and they're quite dysfunctional and quite confused. And there can be a lot of unlearning to do, because there's a lot of information out there about breathing, and a lot of it's wrong. I get stuff into my inbox almost on a daily basis that's encouraging people to deep breathe. And the belief that deep breathing is good for you is a Western disaster. And then for us to work against that, because we're essentially teach people to breathe less through relaxation, not control. And that's a big myth that we're going up against. And we've got, yoga taught properly is spot on about breathing. The asanas, the postures often restrict the breathing, but you can be in a yoga class where the teacher tells the class to take a deep breath 50 times throughout the class. We've got a lot of poorly trained yoga teachers in the West promoting deep breathing, and a lot of them don't have very healthy breathing themselves. Their own control pulse would be pretty low. So there are some amazing people within the yoga world who have learned Buteyko, who are starting to change things from the inside, which is really great. People like Robin Rothenberg, she's an American teacher. So things like, it can be hard for people to work out. So you've got the Wim Hof method where you hyperventilate, and then you've got the Buteyko method, which seems to be the opposite. How does it all work? I'd say the difference with Buteyko is it's very thorough. It's looking at normalizing all aspects of the breathing in all situations. We're looking to normalize your baseline breathing pattern. And then methods like the Wim Hof method, they're more special effects breathing exercises designed for a purpose, and pranayama is the same. They're not going to fix, the Wim Hof method isn't going to fix a dysfunctional baseline breathing pattern. And it can be quite effective for some, for some people, generally young, fit, healthy men. But for people with dysfunctional baseline breathing pattern, it can be quite disastrous.
I agree.
It's knowing with all of those different techniques out there, where they fit in and whether they're appropriate for you. And if you have poor breathing health and a really low CP, a lot of those, you shouldn't be doing pranayama, advanced breath work designed for someone with a perfect breathing pattern. You should be doing the Wim Hof method if you have a very low CP and poor breathing health.
So how come that his method catched so quickly, and it is so popular, and the Buteyko method is less known? I don't
know. He's been remarkable with his marketing, hasn't he? It's pretty sensational and interesting, and he's good at courting the media. And as I said, for some healthy, fit people with good breathing health, it can be amazing. There's no doubt there's some benefits to it. Like promoting the production of killer T cells and enhancing the immune system and generating a short-term stress response, which can be quite beneficial.
I see. Last question. Do you remember any case that you treated in your clinic with the Buteyko method that amazed you, that you didn't believe the results? Or any case that...
I'm just trying to think. I know there is some, and I just can't think which. I'm amazed all the time. Every time someone does this properly and they actually put into practice everything that I recommend, I'm continuously amazed at the results that they get. I hear life-changing on a regular basis. when someone comes off their CPAP machine and they no longer have sleep apnea, that's pretty amazing.
That's right.
Yeah, and when someone with chronic anxiety and panic attacks becomes calm and relaxed and no longer has panic attacks.
Nice.
That's pretty amazing too, pretty life-changing. Yeah, I have one case. I know I have one case where I was amazed at what happened, but I can't remember what it was. Sorry. I can't pick it. Yeah.
Did you maybe of other practitioners?
My own story. My own story.
Right. Yeah, that's right.
Absolutely.
I never heard of someone healed of epilepsy with breathing, and
I've just worked with a young woman who with epilepsy. There's a lot of similarities in our stories, and she's been very compliant. She's put into practice everything I've suggested, and she's now coming off her epilepsy.
You know, Artur Rakimov is one of the scientists. I think he is very scientific about it, with the little details. He even mentioned very rare diseases, like Dupuytren, which is the thickening of the fascia in the palms, like scarring of the connective tissue in the palms. He says that he's talking about arthritis, about Raynaud's disease, and I think they are all connected because of the poor circulation to the extremities. So do you see a connection between an anxious person and less flow of blood to the extremities, especially?
Yes, it's very common for my clients to have cold hands and feet, which is a classic sign of poor circulation. And what you're talking about.
And is it correlated with anxiety, with emotions of fear? I'm asking because, you know, we even say fight, or freeze. So the freeze, the temperature, the cold temperature is correlated with fear, with stress, with the sympathetic nervous system.
Yeah, so when someone's in that state, their circulation is reduced, you know, fight or flight mode. The blood flow is diverted to the brain, the heart, and to run, and diverted from the peripheries, and crucially, the blood flow is reduced to the gut. So often I see anxiety and panic going along with poor gut health as well as poor circulation. So the trick is, changing the information that your body's getting from one of threat to safety. Nothing in the body works well if you're in a sympathetic dominant state. And I see people all the time, and they're always in a sympathetic dominant state. That's right. And they breathe, and how you breathe at night follows how you breathe during the day. And they're sympathetic dominant even in the night, and they're not getting down into a deep restorative stages 3 or 4 of sleep and getting that rest and repair happening at night. And so, of course, that plays a role in them being sympathetic dominant in the day. Again, a very vicious cycle. And so the other thing that's down-regulated when someone's in that anxiety, stress, panic state is the immune system. So the gut, the digestion and immunity aren't considered important compared to gearing up the muscles to run. So we see all sorts of problems with, related to the immune system as well as to the gut.
So Buteyko indirectly through the gut can help autoimmune diseases, which like the leaky gut issues that derive of a leaky gut. And leaky gut is also a theory. It is not proven, but this is the common knowledge now that autoimmune diseases are a result of
Start in the gut. Yeah. And you could probably take it one step further back and go, and underlying that is potentially faulty breathing.
Yeah. So I'm really grateful to you for sharing your story and expertise about the Buteco method and how it might be a vehicle to life, to a change in the plot of a chronic sufferer.
Yes, what I see too often is people who have been on a long, expensive journey with their health. They have dysfunctional breathing and it's affecting so much, and they've been to so many people and spent so much money, and they get to the breathing last, you know, and it would be great to see a world where people, it's known the importance of the breathing and how it affects the health is much more widely understood, and that doctors understand it, and that people look at the breathing first and normalize the breathing and then look at what's left after that. Would be a much more effective, time-saving, money-saving way to go about health.
I agree with you. You nailed it. And do you think that breathing is even before nutrition?
Yes, I'm a foodie, and I used to think that health was all about nutrition, and now, yeah, I think the breathing comes before that, because you can't. It doesn't matter what you eat or how much you exercise. If you're not breathing well, you're not going to be able to extract the nutrients from that food.
Assimilate it into the cells.
Yeah, and exercise, if you're not breathing properly, is potentially just going to make you more hypercapnic, more stressed, more exhausted. And then the addressing trauma and the whole psychological side of things, that's really vital too. I think that goes hand in hand.
Yes, I agree. To process the issues from the past, to metabolize your emotions together with. Can I ask you? You mentioned before the yoga teachers that they are deep breathers and over breathers. Do you, and in yoga they do promote the breathing from the nose, not from the mouth. Do you see? Did you notice that although you are aware to the nose breathing, that people without paying attention are mouth breathers?
We're seeing it more and more.
Like when we talk.
Yes, yeah, interesting. Yeah. I just want to step back and say, not all yoga teachers are promoting over breathing. There are some wonderful, teachers out there. So just to be wary if you're being taught. When a yoga teacher tells someone to take a deep breath, they mean deep as in diaphragm rather than shallow as in upper chest, and that's correct. But there's a problem with the wording there, where if you tell someone to take a deep breath, they will inevitably take a large breath. They'll increase the volume of the air that they're breathing, and that's the problem there. So it's about cueing. And yeah, it would be great. You can go into a yoga class these days and be surrounded by people who mouth breathe through the whole class, and the teacher won't actually point it out. It would be great if we could, that's just such a basic, for breathing, just for them to be picking that and encouraging people to nose breathe throughout. But I haven't quite answered your question. What was the Can you ask me your question again?
About the mouth breathing, because even if you are aware that nose breathing is the way to go, do you notice yourself, let's ask it like this, do you notice yourself breathing through the mouth during the day? Never?
No. There's nothing about the mouth that's an airway. It's a backup for emergency only. This is the nasal, this is the airway. And the nose that you see on your face is only 30% of your nose. 70% is in here, and that's valuable real estate in the head. You've got to use it, and your immune system starts here. Yeah, you can't breathe normally if you're a mouth breather. But often, when people are mouth breathers, sometimes it's just lack of awareness. They don't realize they do it. They don't realize the devastating impact it's having on their physiology, and it's just a bad habit. And just through education, they can fix that within a week. Other people, if there's more going on, as soon as you mouth breathe, you at least double the amount of air you're breathing, and this contributes to congestion in the nose and inflammation in the nose. And so as a result of mouth breathing, they're blocked up. They think that they mouth breathe because they're blocked up, but the over breathing would have led to getting blocked up. But they're stuck. So it's a more complicated process to turn that around, but it can be done. And I would say it must be done. If you're going around, you're congested all the time, or maybe you're not congested in the day, but you're waking in the morning and you're all congested and blocked up, that's a classic sign of over breathing, of dysfunctional breathing. So what we're seeing is just an epidemic. It's really worrying. Children, up 25 to 50% of children mouth breathing these days.
That's right.
And parents not even noticing it, the doctor not even picking it up. I think we've lost a lot of knowledge over the years. I think if my grandparents had seen me walking around like that, they would have said, shut your mouth, but now it's just become so common. It's a bit of a worry. But it's really good to get to the children, because often it's just awareness and teaching them the basics, and it's much easier for a child to normalize their breathing than it is for an adult, especially, it can be done with adults, but it takes more time, and the older the adult is, and the more medications they're on and the more health conditions they have, the longer they're going to have to work at it. They might have to work at it for the rest of their life. But if we can get to the children, it's a pretty fast process. And then you're getting information and knowledge to them that they'll carry for life, and it'll be preventative.
I see. So really, really last question now. If someone is hearing you or seeing you now talking about the Buteco method, and he feels compelled to try it, to give it a try for his condition, what would be one tip that you would equip him with about how to start, how to relate to it, how not to fail, how to really go through this gracefully? What would be an advice that you give him before he starts?
See, you mean if they're going to do a Buteco course?
Yeah.
It's really important that your expectations are realistic, that you realize it's not a quick, easy fix, that it's a long game. You're playing a long game. And the older you are and the more complex your health and the more medications you're on and the more issues you have, the longer it will be. So you're talking months and years, not days or weeks, to rehabilitate a breathing pattern that's taken years to deteriorate to where you've got to.
But for you, it took only 6 months to get off of the drugs completely.
yeah, but I still didn't have ideal breathing. It's taken me more like 6 years to get to where I am now. But if you get the right teacher, that process can be very much shortened. Yeah, a teacher who can help you to understand.
So in your opinion, what is a good teacher to the Buteyko method? Because there are the category of teachers which are very harsh and very, very strict, very stiff, and there are the more softer attitude.
If you're being taught to control your breathing, get a new teacher. You cannot get a long-term permanent change to your drive to breathe through controlling your breathing. You just can't. It doesn't work long-term, and you may cause more trouble. And also, what you're being taught should be being tailored to you. It's not a one-size-fits-all. The breathing exercises that would cure someone with asthma could kill someone with uncontrolled diabetes, you know.
Yeah.
So, you know, the teacher should take a very thorough health history and you know, get to know you. There shouldn't be just some prescriptive online thing where, you know, it's the same exercise has been given to everybody. Also, I would say Dr. Buteyko cautioned that his method should never be taught by video, like pre-recorded video as well. That's an interesting thing.
Why not? Because of the tailoring thing? Because of
yes. And you've got to be, as a practitioner, you're watching the people all the time and seeing how they're responding and picking up if it's not working for them, or if they're not quite doing it right, or, you know, maybe because they've misunderstood, and you're continually working with them and honing and refining. That's all vital, and that can't be done in pre-recorded videos. But that's the way that health's going, isn't it? There's people trying to make a quick buck, you know, pre-recording everything so they can go live on a beach while their course makes money for them. You know, there's nothing wrong with, I don't think, with Buteyko being taught online, but it needs to be live with the practitioner. And ideally, like when I work with someone, I do a breathing assessment first. So I really know what, and we get a thorough health history, and it's all in writing, and we really know what's going on with that person's health, and I can get a bit of a picture of what's going on and how they've got to where they have. And then I always give them preliminary recommendations to get started on straight away. Sometimes, you know, nose breathing and starting to breathe less all in 1 week of the course is too much. It would trigger someone. So between having an assessment with me and doing a course, they go away and they work on nose breathing. That can be enough. That's enough of a physiological change for some people. They don't need the breathing exercises as well all at the same time. And then, yeah, and so then they do the course, and then for my clients, we do 4 days, and then they go and practice what they've learned for a week, and then we do another session a week later, and then they go and practice everything for 6 weeks, and they've got as much support from me as they need over those 6 weeks. That's really important too. And then we do a follow-up, a one-on-one follow-up in 6 weeks, and we, you know, see if where they're at and where we need to go from there. And so, and also what's quite important, I think, is assessing symptoms and assessing progress. So when I do a breathing assessment with someone, we do a very thorough assessment of breathing related symptoms, and we get a score. And then 4 days into the course, we assess again. And a week later, we assess again. And 6 weeks later, we assess again. So we're tracking and measuring how they're doing and measuring their results. And that can be really important for motivation. People can forget how bad they were when they started. And they can think, oh, I don't think I've really made that much progress. But then we do a reassessment and their symptoms have halved, and they're like, wow, and it's really motivating. This is working, it's motivating to keep
Yes,
going.
yes, it is because when you measure it, you can improve. When you feel the improvement, you feel motivated to go on.
Yes, yes, and but yeah, it's really crucial. The motivation is a really crucial part of this. Without it, you don't get very far. And a part of that is having the physiology and the breathing explained to you in a way that you get it, that you really truly understand that breathing is causing this brain fog or the anxiety and panic. And then that helps to motivate you to want to rehabilitate the breathing.
I agree with you. It's kind of it is the elusive obvious. It is so obvious, and yet it is not. It is somehow hidden.
Where people aren't too convinced, they're not too sure. It's like, yeah, they've got to be hooked. They've got to get it and be inspired and believe what's possible with breathing. And I'm proof of it.
Yeah. Your story is fascinating, and really thank you so much, Nicky, for sharing it and with so much vulnerability, and I appreciate it. And I wish you nothing but joy and health.
Thank you. And if anyone wants to know more, if they have any questions, like I love this subject, I love my job, I love my work. People are welcome to email and ask me questions.
Yeah,
I run the breathing clinic. You just Google the breathing clinic and find my email, and you're welcome.
Of course, we will put the links in this article. Thank you so much for your work. Good day to you.